come and talk to us about Medicare fraud and different fun things like that. So welcome,
That's right.
Scott.
Thank you. Thank you, Susan. And thanks for coming out on a rainy day. Nice to be here. I am from the Massachusetts Senior Medicare Patrol Program, and we are a federal program run by Medicare, but there's one in each state. So Senior Medicare Patrol, also known as SMP, is based out of Lawrence, Mass. We're a part of the Elder Services of the Merrimack Valley, which administers the program for the entire state of Massachusetts. So we do go out to senior centers all over the state. We have volunteers in different areas of the state that do presentations. We also work with people who have problems with their Medicare billing, who think they might be victims of fraud or might have errors and don't know quite where to go to get things fixed up. And our phone number is the 800 number on the front of this booklet that I passed out called a Personal Healthcare Journal. So most of what I'm going to talk about this morning is in this, and I'll kind of point that out as we go along. So we are run by Medicare. Medicare, as you know, is a big program. It's been very popular with senior citizens since it was started in the 60s. And it bills just about $2 billion, $2 billion with a B, every day. So the total program in the US per year for Medicare billing is in the realm of $700 to $800 billion. So that's a lot of money. And there's a problem with that in that it opens up opportunities for people who are trying to scam people and defraud people to siphon money off of Medicare, and that hurts everybody. So Medicare estimates that up to 8 to 10% of total Medicare billings are lost each year due to fraud, errors, and abuse. So our group tries to inform consumers like yourselves to see what you can do, what kind of steps you can take to avoid being scammed, and also to look out for errors, because there are a lot more errors, fortunately, than there is fraud, but both of those things are problems. So that's what we have, just a few simple tips for you based on this booklet that you can use to try to pay close attention to your healthcare billing and make sure that it's what it should be and not a problem. So that 8 to 10% that Medicare estimates is lost to fraud every year and errors amounts to approximately $60 billion a year that's lost. That's a lot of money. And with everybody becoming more informed on what to look for, maybe we can reduce that number. So what I'd like to do is talk a little bit about what fraud, error, and abuse is in Medicare, and then give you a few simple ideas on how to avoid it and how to look out for it. First of all, does anybody know if you have been a victim of fraud? Okay, hopefully you haven't. Some things outside of healthcare are if your credit card number gets stolen. So sometimes you might hear from your bank that you've got credit card charges that are, 1,000 miles away from where you are, and that means that somebody's gotten a hold of your credit card number and using it, and you might have to close out your account, get a new number, that sort of thing. You're working with your credit card company on that, or your bank. Healthcare, the same kind of thing can happen. Your information, which is private and belongs to you and linked to your healthcare, sometimes can get stolen if it's not protected. And if that happens, then you might not even know it, but somebody might be using your information to defraud Medicare and siphon off money from the Medicare system. So that does happen. Hopefully it doesn't happen too often, and hopefully it doesn't happen to you. But what fraud is are intentional misuse or lying or misrepresenting entities that might be billing Medicare to make money. So those are criminal activities, and that's fraud. Errors are things that can happen to anybody and are unintentional, and that's the main difference. For example, has anybody ever had a billing error in your Medicare or in your healthcare insurance? I see a couple of hands. What you did is exactly what I'm going to recommend doing, which is if you want a way to know what your services were and also how to compare them to what Medicare or any other insurance says got done and was paid for or not paid for. And by comparing those, then you can determine that there may be an error there. It may not be an error that you caused, but somebody, you know, in the chain of events has caused an error, and you need to get that fixed. We'll talk in a little bit about exactly how to deal with that. It sounds like you already have a head start on that situation. Using the Medicare Summary Notice, or the MSN, which is something that you should get every quarter. If you've been on Medicare, you know what that looks like. Errors are extremely common. I was speaking to a group the other day, and somebody got double billed by a hospital and a clinic for services on the same day that were only received once. So somehow maybe in their information system, there was an issue, and that billing happened twice, and of course was only covered once. If you are on top of that, looking at those notices, you'll be able to find that out. Double billing happens a lot. It might be a human error, it might be something in a system that's not set up right. Those are errors, unintentional. If it happens a lot, but it's unintentional, let's say a hospital billing department is using the incorrect code for something like a hip replacement. They're using a code for a hip replacement with complications. That's a much different code, even though it may be similar in terms of numbers. It gets billed at a higher level, and that would be an error if you only had a simple hip replacement. If that's the case, you might not even know that's an error, but it is. If they were doing that as a rule because they had the code set up incorrectly in their system, that would be what we call abuse. So that abuse is multiple errors over a longer period of time, but unintentional. Fraud is intentional, and that could be happening with criminal intent, or should be considered criminal intent. An example of fraud might be if you had surgery in a hospital and then had to go to rehab in a nursing home. If the nursing home was giving you therapy, but then deliberately billed for a higher level of therapy than you received, or billed for more units of therapy than you received, that would be fraud, and that is criminal. So those are things that you want to watch out for. Hopefully you're not going to be the victim of actual fraud. Yes?
So if you did find something like that, you say it's illegal, call Medicare and...
Yeah, there are a bunch of things that we recommend that you do. First of all, and I'm just going to go through this briefly, and in this book on the back cover, there are 3 things that it recommends that you do: protect, detect, and report. And I'm going to talk about each of those and what they mean. So the first thing we recommend is that you protect your information. And anybody have an idea of what we want you to protect? Your Social Security number, yes. You know what's out there. I mean, you make a good point. You know, there's nothing completely private out there, because many financial institutions and other institutions use Social Security number as part of the security of your account. And unfortunately for everybody that on Medicare right now, Social Security number is basically your Medicare number plus a letter at the end of it. So that makes it, 1 degree easier for people to try to steal your number or get you to give up your number. That is going to change in a couple of years, within a couple of years, starting next year, and it's probably going to take about a year. Medicare is going to change the numbers so they're not linked to your Social Security number. So that will happen. You'll probably get notified in the mail because they're not going to call you up and talk to you about your number. But that still means it's a number that you want to protect. You don't want to give it out. You don't want to carry the card around unless you have to, as you're going to see a healthcare provider for the first time, for example, and they need it. But otherwise, you don't want to give that out. If somebody has your personal information, then it opens up the possibility of fraud to a greater extent. So you want to protect that. You don't want your identity stolen. That doesn't mean it can't happen, but if you take those steps to keep it as private as you can, that's the first thing we talk about when we say protect. So protecting your personal information is important. The second thing we talk about is to detect errors, and the way we recommend detecting errors, looking out for fraud and abuse, is using this personal healthcare journal or something similar to take notes of your healthcare encounters. So if you have a doctor's appointment, or if you're going into the hospital, or a rehab facility, or home health, or whatever you have, we recommend that you keep a journal with notes of each occurrence and what's happening, what services, what your discussion with the physician is like, and that sort of thing. And just to orient you to this, the side that says Personal Healthcare Journal, the first half of this is a place to put your personal information, list your medications, who your providers are, and that sort of thing. And the second half of this is to list each encounter and make notes as to what services you have received. Then, if you're doing that and making a note of what services you do receive in your health care, then when you get billed from Medicare, when you get your Medicare summary notice that comes every quarter, and if you have supplemental insurance or other insurance, you get the equivalent type of report called an explanation of benefits, or an EOB, all those things that say this is not a bill on them. If you have that information and you have a journal of your what your healthcare encounters were, you can compare those and say, oh, this date of service, Medicare says this happened to me, I can match that up, that's good, I should be all right. If you see a date of service and you know you didn't have anything done, you weren't at the doctor's or at a hospital, or you know there was no health care going on, then you know there's a problem. And if you see services that you know you didn't have, that's another problem. So that gives you the opportunity to compare. So when you're looking at, let's say, a bill from a hospital, you had something that you know as a simple thing. I had shoulder surgery, They might have a list of charges like that that has all kinds of stuff in it that you don't know if that applied to your surgery or not. Chances are it did, because you know how that works. There's a lot of charges that go into a hospital stay. In addition, what you were talking about is you're not sure which provider was involved in that. You have your personal physician, and you know there was a surgeon involved, and you probably know the name of the surgeon. You don't know the radiologist, you don't know the anesthetist, and there may be 4, 5, 10 different providers involved in that encounter. So it is a real good point that you're not going to know exactly. Healthcare is very complicated. You're not going to know exactly what every charge was. and who every provider was, and if this is all legitimate in terms of charges. Usually it is legitimate, but you don't know. So if you have that Medicare summary notice, you're looking at that and it says, here's the encounter, here's the provider. If you have questions about that, then you want to know, where do I go with those questions, which is the same thing you were asking, and you were saying, do you call Medicare? Well, you can call Medicare. You can, if you think there's something fraudulent or there are errors, what we recommend first is to call the provider that you went to. So if you're talking about a physician's office visit, usually your first recourse is to talk to that office. So, you have a relationship with your physician's office. If it's a hospital, you call the hospital, that sort of thing. Are you familiar with a SHINE counselor? The term SHINE?
Yeah.
Because that's another Medicare program, national program run by Elder Services, similar to us. But the SHINE counselor can look into your coverage and help you figure out what's best. So if there's something missing, there's a gap in that coverage that you can fix by setting something up, then they'll help you do that. And if there's a problem with a past service because your situation wasn't right, then you can do things like appeal to Medicare. What you can do is, if you're in that process and you're having problems and you're not feeling like you're getting to the appropriate place, you can talk to SHINE or talk to us. And our phone number is on this.
But thank you very
No, that's
much.
fine.
I'm sorry I can't stay.
Fine, I appreciate it. So, as we were just talking, sometimes those are complicated, those issues. You're not sure where to go with it. You can always call us and we'll help you do that. Or the SHINE counselor, who probably comes here on some kind of frequency. I would schedule an appointment with that person and try to get some help with it. But these last couple of questions deal with our third thing of report. Who do you report to and how do you fix the problems that you might run into? And as I mentioned, what we recommend initially is that you talk to your provider, so the person who was directly responsible for that care, and say, I don't really understand what this notice says, and it doesn't really match up to what I thought my service was. Is this legitimate, and can you explain it to me? And they should be able to do that, your billing office at either the hospital or the physician's office. If you think there is fraud involved, there are some numbers that you can call, including us, which is the one on the front. But if you look at page 2 of this booklet, about the second page in, there is a list of reference numbers that you can call for help. And we're the one on top. That's our 800 number for the Massachusetts Senior Medicare Patrol Program. But you see in there are some other things that are for different purposes, like the Attorney General's office. If you think you have been defrauded, or if you think there's something fishy about something involved with your health care, that's Maura Healy's office in Massachusetts. And there are a couple other things in there. There's a fraud hotline. So some of these kind of have overlapping services, but are available to you, especially if you called Medicare and waited for 5 hours, and if you think that's going to be a problem, some of these numbers will get you a little quicker response on the phone. The one on the bottom of the first page of that, called Levanta, I don't know if you can see that. Levanta is an organization. There's one in every state called a Quality Improvement Organization, or a QIO. If you are in the hospital and the hospital says, okay, we're done with you, you're ready to go home, we're going to discharge you tomorrow. If you're not ready, if you don't think you're medically ready to be discharged, or if you have a healthcare advocate, a relative or somebody who's with you, and basically don't think that the patient is ready to go home, you can appeal that discharge to Levanta while you're in the hospital, and they will look into it and make a judgment as to whether that's legitimate, that you need to be discharged, or your stay can be extended. So they look into the situation clinically with you and help determine if that's going to be a legitimate discharge or not. So that's a good number to know. And they work real time. So if you call them, they work that day to try to figure out what's the story with your stay. And there's another one I want to mention halfway down the other page called the Medicare Advocacy Project, or MAP, M-A-P. And the gentleman that was here before talking about his appeal of a Medicare charge, if you're wanting to appeal a charge that you see on Medicare, and you're not sure how to go about doing that, you can call MAP, the Medicare Advocacy Project, and that's basically legal services for Medicare patients. So they will help you try to figure out, first of all, do they think you have a case of fraud, that sort of thing, but also how do I appeal, how do I go about it, do I need a lawyer, all that kind of thing. So MAP is a good thing to know about. So those are the things I wanted to cover. For Medicare errors, fraud, and abuse, it's a big problem. Hopefully it's not a big problem in your individual cases, but what we recommend in terms of looking out for it is to protect your information, to detect by keeping a journal of your healthcare encounters and comparing it to your Medicare summary notices and your explanation of benefits from any other insurances that you have. See if there are discrepancies or questions, and then the third thing is to report those things to the appropriate party, which could be us, the Senior Medicare Patrol Program. It could be Medicare itself. Hopefully they'll have a quicker response than 5 hours. And it could be any one of these other numbers that are here for your reference. So that's really what I wanted to cover today, and I appreciate you taking the time to listen. You can keep these journals. I do have some calendars for Medicare here and a couple other things that might be useful.